Okay, Jill Biggs, this is video 2 of video response to your Outlaw Circumcision, which I completely agree with. And I'm getting into your question of why you don't understand why people would do this to their child. Like I said before, the simple answer is they're just misinformed. And they are just going with tradition. I mean, it's a non-religious tradition now in America for boys, for most boys, to be circumcised pretty much as a newborn. They don't understand the ramifications of this procedure. And I'm not really talking about the physical ramifications, because compared to the emotional, the psyche, and the bonding experience between the infant and the mother, the physical trauma is minute. I mean, it's traumatic physically. Yes, it is extremely painful to have your genitals cut away, awake with no pain relief or minimal pain relief, and to even go through the healing process. So yeah, most people don't realize that it's not done with anesthetic, and the procedures that are done with anesthetic, they're done. The application of the anesthetic itself is painful, and even with that, it still does not numb all of the area that has to be cut away and sewn up. So people don't really understand that either. They don't understand the laws involved and how the parents don't have the right to consent, but I'll go into that in a moment. But let me stick to this about how the ramifications of the bonding between the child and the mother, and of course, the emotional ramifications. So, okay, and of course, I guess it's painful, and now you have a raw open wound that even if you were administered anesthetic, the anesthetic wears off, and now the baby's in excruciating pain because it's a surgical procedure. They don't have any pain relief. They have an open wound next to the urine and the feces, and of course you know this already, so that's a higher risk of infection and complication. And also, the physical traumatic experience, the pain, has caused complications during the procedure and has caused death. Yes, circumcision causes death in infants every year during the procedure. But of course, they will always document it as something else being caused. But of course, I mean, come on, think about it. You have a completely healthy baby boy, okay, just born. He's doing great. You strap him on the table, no pain relief. You cut off his foreskin, he's screaming to the top of his lungs, and then he dies of a heart attack. That's happened. It's happened where they bled to death because the incision was done wrong and they mixed something and too much blood was lost. There's been all complications like this, and it happens every year. And it's, again, something that's an unnecessary procedure. Medically unnecessary procedure performed on non-consenting children, and they die. If people don't understand this, now compared to the millions, a couple of thousand a year or a couple hundred or whatever, not a big deal as far as numbers, right? Okay, well, people are not numbers. Okay, so I don't have to even go into that. So, yeah, once the baby is circumcised, he is emotionally traumatized. When the baby comes out of the mother's womb and he has that bonding experience for the first 2 hours, I mean, that's something that could never be replaced. If that's done and then the baby's taken away and then they're strapped down to a table and this procedure is done to them and then they're given back to their mother, they have lost trust. No, they don't understand completely everything that's been done to them because they're still a baby, but they understand that, hey, I was taken against my will because I don't want this done. They're telling you when they're screaming that they don't want it done. And they're screaming for their mother. Their mother is not around, who's supposed to be protecting them. And this happens. Now the baby is in excruciating pain. He is emotionally traumatized. How do you expect this baby boy to bond effectively with the mother? It's very difficult for a circumcised baby boy to start breastfeeding now. because of this whole experience. The pain, the emotional bond, they don't want to. A lot of them go into shock. You can see it in their face. They're traumatized, and they will be like that for a very long time. In fact, they've done studies on circumcision and cortisol levels in the body, which is a hormone that regulates stress, and it's released by the adrenal glands. When a circumcision is done on an infant baby boy, cortisol levels skyrocket. And for a little over 6 months after the procedure is done, those cortisol levels do not go back down to a basal level, which is supposed to be the like a balanced level of cortisol in the body. When you have elevated cortisol levels, it causes many complications: your immunity, how you think, how you develop, your brain function, your muscle development. If you do your research on cortisol and how it affects the body's elevated cortisol, you'll realize that that is how, also physically, besides the pain, how it traumatizes the child. So these are all reasons why people are just not informed. And if they were informed and did a little homework, spent a couple of days and just researched the hell out of this, they'd find this out. And I'm sure their views on it, even grandparents who have had this done, if they just did their research and realized, hey, this is not what we've been told it was. So it's a serious issue, serious issue. So moving on. Okay, yeah, I already touched about this. The whole it's okay, it's the norm. But why do we conform to the norm? I talked about people being sheeple, people being sheeple. You also asked about why are the doctors doing it? I kind of touched on that a little bit. They're also misinformed what they've been taught in medical school. They're indifferent about it. Most of them, not all of them. There are some who really understand that this is not medically necessary, who won't perform the circumcisions, or who will speak out against it and inform parents or whoever, and kind of be a part of this movement of informing folks about it. But most of them, of course, they're also circumcised. Some of these male doctors, and most of these male doctors, and they do it, and it's just like nothing. You have to understand, in medical school, they don't really teach about the functionality of the foreskin and how important it is to the body, what it's there for. I mean, it's not just a piece of worthless skin. It's there for sexual performance. It's there to prevent infection. Yes, prevent urinary tract infections, because it covers the urethra, where else it would be exposed to air. That it's supposed to be a sterile environment. Also, it doesn't retract as an infant. I think it's like after a couple years, it starts to retract. So you're not supposed to retract to clean it. You just clean it regular, and it will do its thing. I mean, the body doesn't need fixing. The foreskin is not a malformity. It's there for a reason. So it's parts of the sexual functionality, the hygiene part of the body. It protects the gland or the knob of the penis from becoming desensitized or during intercourse, and also adds lubricant to the penis, and also during intercourse to the woman's vagina. It helps to keep the lubricant in there, and it makes it pleasure for both partners. Sex for both partners much more pleasurable, which is the way the universe intended it to be. Foreskins are there for a reason. So yeah, I mean, this whole thing about it's cleaner. It's not cleaner. I mean, if you don't take a bath, yes, bacteria and stuff, just like any other folds in the body, will collect and you can get an infection. But those infections can be easily treated with antibiotics or prevented entirely. You don't have to cut it off. Especially a child who's not consenting without medication, pain medication. So, okay, so my time's about to run out, so I'm going to do one more video. Hopefully I can get all your questions answered. Again, thank you for your patience. This is also a very passionate issue for me, and I really appreciate the opportunity to do a video response and let you know how I feel as well.